So Josh, let me ask you a little bit of a question about, because I dealt with this problem when I worked on Capitol Hill for a member from Tucson, Arizona. This was in the late 90s, early 2000s. And we had an issue there where we had lots of these Medicare Advantage plans that were exiting the market because they found that these networks, they were having to pay, commercial market rates to doctors and hospitals, et cetera, not the Medicare rates. And so they would go, these plans, these HMOs, for example, would go to the federal government and say, hey, if you want Medicare Advantage to continue to survive, for example, in Tucson, Arizona, you need to give us a bigger capitated payment because our costs are higher than yours. We have to pay, commercial market rates to our physicians and hospitals. But it sounds like what you're saying right now is that's not the case, that they're actually able to provide these services cheaper. Is it because the average Medicare Advantage beneficiary, the senior citizen, is healthier than your typical Medicare beneficiary? I'm wondering about the mismatch between, hey, if we want this network to be viable, we need to pay private market rates. But then on the other hand, we know that they're making enormous profits off of Medicare Advantage. So I'm trying to figure out what's going on here.
So what we've found over time is that Medicare Advantage plans tend to pay physicians and hospitals about the same rates as traditional Medicare now does. So that is one advantage these private insurance companies have over private insurance companies outside of Medicare for Affordable Care Act or employer-sponsored health insurance, where the payment rates are much higher because it's commercial insurance instead of tied to Medicare, which is able to set their prices. So that's not really where they've now been able to save. And then your other question really gets at the issue. I think over time, the Medicare Advantage population has been either similar to traditional fee-for-service Medicare in terms of health status, or maybe a little bit healthier relative to traditional Medicare fee-for-service, but they're paid substantially higher relative to Medicare fee-for-service because the insurance plans are able to make their patients seem sicker and garner higher payments. And this is really the key part of the overpayment problem, that because of this risk score gaming, we call it coding intensity.
I was going to say, is this upcoding?
Yeah, they upcode and code more diagnoses on every patient's record, making their patients look sicker than they would in traditional fee-for-service, where doctors don't really have to code your health status other than for the very specific problem they're being paid for, because it's fee-for-service. So over time, they managed to game this, and our estimates are about 17 to 20% of their payment comes from this upcoding, which is a huge amount of money. So when we look at the current controversy, so we estimate that having that coding intensity problem fixed entirely over a 10-year baseline would save about $350 billion. So wow. Just for perspective, there's a current controversy over whether Medicare can go back and look at past patient records to try and see where this upcoding is happening through what we call risk adjustment audits. And the estimate is that CMS could save about $4 billion by going back and looking to kind of validate these codes. So that's $4 billion of what we estimate is about a $350 billion overpayment. And yet that has led the insurance industry and members of Congress to attack the Center for Medicare and Medicaid Services for trying to cut Medicare Advantage and scare seniors. And this is a huge problem. You know, both of you have been around the budget world for a long time, and we often get very upset when politicians say they want to cut waste, fraud, and abuse as the main way to save money in the federal budget, right? And we say that they need to put specifics on the table instead of just saying waste, fraud, and abuse. However, over time, they have forced the administration, over past administrations, to figure out ways to actually get at waste, fraud, and abuse. And this is a perfect example of a way to get at waste, fraud, and abuse. It would save about $4 billion. We actually think the potential could be much higher savings, $12 to $20 billion, but they actually gave insurance companies a break and let them off the hook for past waste, fraud, and abuse. They're only targeting like the most recent 5 years. And still, their politicians and CMS are being attacked for cutting Medicare Advantage, and it's just a huge problem. If we can't save money on this kind of thing, we have no hope for the federal budget going forward, because for once we found waste, fraud, and abuse that we could actually get at, and still it's being demagogued by members of Congress in the insurance industry. And honestly, the insurance industry is no surprise, but politicians and members of Congress and policymakers in general should know better than to demagogue this kind of thing, and yet that's what they're doing.